Have you ever seen someone smile and suddenly noticed something was off? Not yellow teeth, not missing teeth, just teeth that look like they've been eaten alive by something invisible. Now imagine that person is you, and all you did was take a medication millions are now calling a miracle. This is the story of Ozempic Teeth, and it's not just happening to one or two people. It's happening everywhere. If you're using Ozempic or even thinking about it, what you're about to hear could save your smile, and maybe even your sense of self. Let me take you back to the first time I read a Reddit post from a woman who said she woke up one morning and found her entire molar had just cracked off. She wasn't chewing rocks. She wasn't grinding her teeth. She was just taking Ozempic. She called it the silent thief of her smile. And she's not alone. Ozempic, hailed as a weight loss wonder and diabetes miracle, is changing lives. But hidden beneath its life-changing benefits is a side effect that could destroy the very confidence people hope to gain by taking it. So today, we're talking about the real story behind Ozempic Teeth. The pain, the science, the silence, and what you need to know before it's too late. Let's break this down. 1. The miracle drug, with a hidden price. Ozempic, Semaglutide, was developed to treat type 2 diabetes, but it quickly exploded in popularity for its dramatic weight loss effects. Doctors were calling it revolutionary, celebrities were quietly endorsing it, and millions of people were injecting hope into their bodies every week. But while the pounds melted off, something else began to erode. Their teeth. People started reporting dry mouth, cracked teeth, gum infections, and even full dental collapse. But no one was listening, because no one expected a diabetes drug to affect your dental health. 2. Dry mouth, the first silent signal. Ozempic works by slowing digestion and reducing appetite, but it also seems to reduce saliva production. Now think about that. Your saliva isn't just spit. It's your body's first defense against acid, bacteria, and tooth decay. Without it, your mouth becomes a battlefield, and your teeth are the casualties. Imagine brushing and flossing perfectly, but still waking up with tooth pain or bad breath. That's what happened to Jake, a 34-year-old teacher from Ohio who said he never had a cavity in his life, until Ozempic. Within 8 months, he had 5. 3. Weight loss can weaken more than just fat. Rapid weight loss can put stress on your bones, and your teeth are bones too. In some cases, users reported sudden changes in jaw structure, loosening teeth, and even tooth loss, especially when weight loss happened too fast. It's not just about looking skinny. Your body interprets fast weight loss as a kind of trauma, and trauma affects everything. Yes, even your mouth. Remember Amanda? She lost 60 pounds in 6 months. She also lost 3 molars. She says it took her longer to smile again than it did to lose the weight. 4. Malnutrition. When less isn't always more. Ozempic curbs appetite, sometimes too well. Many users find themselves skipping meals or eating far too little, without realizing they also skipping key nutrients like calcium, vitamin D, and magnesium. These are essential for tooth and gum health. Without them, your teeth don't just decay, they crumble. Ever seen a cracked windshield after a rock hits it? That's your tooth enamel without proper minerals. One woman described it like this: "My teeth felt like chalk, like I could snap them with my fingers." 5. Vomiting and acid erosion. The hidden cycle. Nausea and vomiting are common Ozempic side effects, especially in the early weeks. But stomach acid doesn't just hurt in the moment. When it coats your teeth, it eats away enamel, slowly and permanently. Imagine pouring lemon juice on a countertop every single day. Eventually, it stains, chips, and wears thin. That's what acid does to your smile. And here it's the worst part. Some users didn't even realize the link until after they spent thousands on dental repairs. 6. Shame, silence, and the mental toll. Let's talk about the emotional side. You start Ozempic to feel better about yourself, to look better, to move better, to live better. But then your smile, the very symbol of confidence, starts to fade. People stop laughing. They hide their teeth. They cancel dates. They smile with their lips closed. The emotional toll of Ozempic Teeth isn't just about pain. It's about identity. Sarah, a 29-year-old nurse, said it best. "I lost weight, but I lost my confidence. I don't recognize my reflection anymore." 7. Why is no one talking about this? Here's the haunting truth. This isn't in the commercials. It's barely in the fine print. And because it's not a universal side effect, it's easy to brush off as coincidence. But story after story, forum after forum, dentist after dentist, all point to a growing trend. And yet, silence. Why? Because no one wants to risk slowing the momentum of a billion-dollar drug. And people taking it don't want to feel judged for doing something to improve their health. It's easier to whisper than to speak. 8. What you can do. Starting now. If you're on Ozempic or planning to start, don't panic. There are ways to protect yourself. Hydration is key. So is using saliva substitutes if needed. Speak to your doctor about nutrient supplementation. Make sure you're getting enough calcium, D, K2, and magnesium. Use fluoride mouth rinses. Schedule more frequent dental checkups, even if your teeth look fine. And most importantly, listen to your body. If something feels off, don't wait. Your teeth are trying to tell you something. 9. We need more research and more honesty. This side effect is still being studied, but waiting for definitive answers while people quietly suffer isn't okay. We need more awareness. We need more conversation. And we need to stop pretending that a smile is just about vanity. Because behind every cracked tooth, there's a cracked heart. A person who feels betrayed. A person who deserves answers. 10. This isn't about fear. It's about truth. Ozempic is changing lives for the better, but every story has two sides. It's not about demonizing the drug. It's about understanding the risks before they steal your peace of mind. Because health isn't just about numbers on a scale. It's about feeling whole. So the next time you see someone smiling less, ask why. It might not be about happiness. It might be about something deeper, something breaking behind the scenes. Before you go, if this story hit you, if you've experienced Ozempic Teeth or know someone who has, drop a comment. Your voice matters, and if you found this video helpful, subscribe, share it. Because this is a conversation that needs to happen, and you just became a part of it. Take care of your smile. Take care of yourself. We'll see you in the next one.